What is true for any surgery is that the stronger that athlete goes into the surgery, the better her recovery outcome will be. So I know it sounds kind of generic, but really the stronger you are going into your cesarean, the better your recovery will be, including your scarring. Why? Because you have a lot more vascularity, oxygenation, and more blood flow, because that blood flow is what helps you heal. So the prevention is getting strong during pregnant. And then the other big thing is understanding, the big factors that'll impact your recovery in the first 6 weeks. Knowing what to delegate, getting your compression garments ahead of time, knowing how to get in and out of that bed without hurting yourself. You have a toddler, right? If this is your second cesarean, how am I going to navigate trying to get rest when I have a toddler? So I've got a free resource for that down below. It's the 10 tips your doctor wants you to know. There's all kinds of pain, including hip pain, that happens after a cesarean birth that is common, but it doesn't mean it's normal. In other words, don't expect it to be just a new way for you to be living forevermore, okay? So to ensure that it's just temporary pain, you gotta get it checked out, especially at the 3-week mark. In those first 6 weeks, you just gotta make sure that everything is healing okay. So I would go to your provider, get that checked out, ask some questions. If it's okay, it's like you don't have an infection, follow up with your perinatal therapist. Someone like myself can do an assessment and take a look at what else is going on from a musculoskeletal standpoint. As with any major injury or surgery, you want to start compression as soon as possible. However, because a cesarean is a major abdominal surgery, your body is not going to be able to withstand a ton of compression before that itself causes more pain. So gentle compression, use an abdominal wrap, progress into a compression garment like the ones from SRC Health, and make sure that you keep the area compressed because it's going to really help with swelling and pain in the first 2 weeks, but then that's really going to set you up for really great recovery. Because let's face it, you got to protect your abdominals because you got to use them every moment of the day, and they're not ready to take a lot of load. Things like getting out of bed, like you got to get out of bed, but that can hurt you. So please use compression. Now that's a medical question for a physician, but I know the answer to it. So you are just past the halfway mark of your pregnancy, which means you've got another big chunk of time for that low-lying placenta to not be so low-lying anymore because the uterus continues to grow. So a lot of time practitioners are not too concerned about a placenta previa, for example, at 23 weeks, unless there are other complications happening. So a cesarean is not guaranteed. Now, I would check up with your physician. And a really great physician account to follow is She Found Motherhood. They also have a lot of question stickers like I